Good afternoon, this is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina. I am a specialist in chronic and painful diseases, and I prescribe opiate pain medicine for anyone in pain. At least I could previously before my DEA license was taken away. This is still under investigation and still under appeal. But today we're going to talk about this very important CDC letter of June 16th to the AMA letter of June 16th to the CDC. And if you want to get it yourself, just Google this much and you'll get it. And you can read it yourself. It's 17 pages long, and it's revolutionary. This is our organization formed in 1895 to gather doctors together so we didn't have to worry about all the politics, and they would take care of the politics. As we mentioned last time, this was published by a very prestigious vice president and also CEO. He has two jobs, but anyway. And there's some more things we want to discuss today about the letter. I am going to be summarizing it and putting it on the web soon, and when I do next time I'll tell you where to find it. Here is I've typed this much up so far. The CDC guideline number 5 is the one that's wrecked the country. They did it because they thought they could slow down the opioid overdose deaths. That hasn't happened. They've increased. But this time, a government agency is involved with policies that have really harmed people. And that's what it says in the letter from the AMA. Get it and read it yourself. I'm not here making up stuff. Which is kind of frequent in this business, but anyway, I don't do that. We at JAF are in the business of finding facts and analyzing them and getting together and deciding this is a good fact, this is not. If it's not a good fact, then we throw it in the garbage. Why present things that aren't true? One of them was that we were in an opioid epidemic, an opioid crisis. Those were true, but not any more than it's been since 1970. The opioid epidemic was invented by an employee at the CDC and also a member of the extremist group Physicians for Responsible Opioid Prescribing, a fellow named Leonard Paolozzi. Started back in 2006. So here's what the epidemic is. We have an epidemic right now of coronavirus, and what we have, 100,000 people sick. We got thousands of people dying. But Leonard Pelosi and his associates, Mac and others, said that the opioid epidemic, which is really opiate pain medicine epidemic, was because of the increase in deaths. The increase in deaths were 1 per 100,000. That's not an epidemic. That's made up. So, back to the CDC guidelines, the critical recommendation, there's 12 recommendations. The critical recommendation is number 5. Now, in the CDC guidelines, which by the way, anybody can look up and try to read them. Oh, what a nightmare. Single space, disorganized. But anyway, you can look them up, try to find these recommendations. And all you got to do is Google CDC guidelines March 15, 2016. So here's number 5. When opioids are started, not opiate pain medicine, clinicians should prescribe the lowest effective dose. Wow, that's really startling. Clinicians should use caution when prescribing at any dose. Well, that's true. Should carefully reassess evidence of individual benefits and risks when considering increasing above 50 morphine milliequivalents per day. Okay, carefully reassess. So they're warning you, anything above 50 a day. 50 a day is one oxycodone tablet. We normally prescribe oxycodone 30 milligrams every 4 hours. It's very rare to have drugs every 4 hours. That's why the numbers are so high and everybody gets frightened. So if you're taking one pain pill a day, they have to consider the risks. This 50 milligram equivalent dose just came out of the blue. They just made it up. Now, here's the key thing. This is what's ruined the lives of, we estimate, between 3 and 7 million people. Should avoid increasing doses to 90 milliequivalents a day. That is 90 milliequivalents a day is 2 30 milligram oxycodone tablets. That's not enough for a cat. Should avoid increasing dosage to 90 milligrams a day, or carefully justify a decision to titrate the dose over 90. Evidence for that? Poor. So there it is. They didn't really say do it, but they did. They made it sound like carefully justify the decision. If you don't, you're going to end up in trouble. Okay? That is how the CDC, an agency not tasked by Congress to regulate or make recommendations about medication, over the past 4 years has harmed lots of people. And we're going to find out soon, because we're going to try to do a big census. All right, so the AMA says, all right, here's how we're recommending it be changed. Remember now, the AMA is a doctor advisory. Until the CDC does something, they remain in place. So their recommendation is establish and review treatment goals. Like all medicines, physicians should initiate therapy the lowest effective dose. We always do that. We don't just start with the highest doses. We're not idiots. Continued treatment or increases should occur only if clinically meaningful improvements, right? So increase the dose only if they get better. If you don't get better, you back down. And you want to maintain goals for pain and function that outweigh the risk to patient safety. That's what we do when we prescribe aspirin or any other drug. Now, here's the thing that's different. AMA is saying no hard thresholds. And what is that? 90 milligrams. Hard thresholds. Okay, there it is. AMA says no more 90 milligram cutoff. Now, here's one more thing that's kind of nice. I found here is the 17-page paper. Pretty easy to read, actually, and well organized, because what they do is they list the CDC guideline as it is. Like here. There's the CDC guideline, and here is their suggestions of changes. Anything underlined is a change. So, pretty easy to read. Get hold of it yourself. Pass it around to your legislators, because a lot of state laws, and it discusses that in here, are based on the 90 milligram that needs to go. So, read it, underline it, and send it to your legislators. All politics is local. Start with your local state representative and work up the ladder. They can even help introduce you to your federal representatives. They really want to know what's going on. This is what democracy in the United States is about. State representatives. And don't get on this kick that politicians are a bunch of bums, because they're not. People volunteer to do this job. They don't get paid much because they really are interested in making change. Oh, they're just going, no, they're not going after money or power, not state legislators. These are the people to talk to. I thought this was nice. This was on page 6. Patient-reported intensity of pain may not correlate with the magnitude or identifiable source of the injury. I had somebody write the other day that their doctor dumped them because they couldn't see anything on the MRI. But that's what it's saying here. Pain may not correlate with anything, because objective tests for pain intensity are really still at a rudimentary stage while they're non-existent. The best clinical approach in most circumstances is to assume the patient is telling the truth. Imagine having to write that. All right, so what are we going to do about all this? What we're going to do there it is on the bottom. We're going to try to repeal the CDC guidelines. I'll discuss it more in my little paper that I'm writing, but actually after all these changes are made that the American Medical Association is recommending, there's nothing left. They took out all the bad parts. And all it is a bunch of platitudes that we all follow anyway, like I just mentioned. Lowest dose, be careful, don't go up real high. I mean, it's nice that they're telling us all these things, and it's obvious the people at the CDC don't practice medicine. Or they just really have no idea. So get hold of this letter. And you want to take that letter and maybe a group of people, it's always better to go with a group of people, and say, this policy has torn this country apart. It has ruined doctor-patient relationships. It's now in a phase where pharmacists are refusing to fill prescriptions because they are afraid of high doses. Well, we talked about that before. We're going to talk about that again because that's key. Everybody is concerned about these high doses. There's no such thing as a high dose with opiates. Read the FDA. FDA is in charge of this. There's no upper dose for insulin either. But this is what's driving. Doctors are being arrested for overprescribing and put in the federal penitentiary without selling drugs, which to me is the real crime, selling drugs. Some doctors do sell drugs, but it's pretty rare. So today we wanted to have a little mailbag, but we're going to do it at the end. So this is just some things that I keep in a little drawer, for our show. And it's just pieces of information, questions. I did have a question on my YouTube. When are these AMA changes going to take place? They're not going to change place because the CDC is in charge until we repeal the guidelines. You can say that we're going to repeal the guidelines unless they're approved by the FDA. That would be good. But basically, they've harmed people, they haven't worked, and they need to go. Are there any other people in this country recommending 90 milligrams and tapering? No. Only this organization. All right, so just some things. The Trump administration is stepping up enforcement with the help of the Department of Justice's new opioid fraud and abuse detection unit. 12 assistant U.S. attorneys from around the country and a team of analysts will mine data to identify physicians who prescribe too many opioid prescriptions. Now, we all know that doesn't matter, right? There's 96 million people getting opiates every year, 235 million opiate prescriptions. So the belief is if you write a lot, you're going to addict a lot. But the addiction rate hasn't changed at all. Here's another article. Most people don't actually feel euphoric when they take opiates. You know from our previous talks that if you do not have the gene A118G for addiction, you're not going to get high. That's the problem with addiction. You become extremely euphoric when you take any kind of opiate. That's about 0.5% of the population, 1 in 250 people. Everybody else is not going to get euphoric. This is why opiates are not recreational drugs. And lastly, here's a study. Of the people who misused opioids, 2/3 did it because they were in pain. Another butchered statistic. Well, that's all we have time for today, and next time we're going to talk about how to defend yourself when your doctor tells you he or she is going to taper you off your pain medicines. Good afternoon.